Okay, and so now we're going to talk about liquefactive necrosis. Now, basically, liquefactive necrosis occurs mainly if a person has a bacterial infection or a fungal infection, and that bacterial or fungal infection is basically deriving those neutrophils with all of the hydrolytic enzymes, and they liquefy that tissue or that parenchyma. Now, in cases of the brain, now hypoxic injuries to the brain, such as ischemia, can we said that hypoxic injuries and ischemia to all tissues, they result in coagulative necrosis, except for the brain, because the brain, for some reason, which is an obscure reason, it undergoes liquefactive necrosis. Now, basically, we can explain this in two ways. Either first, we say that the microglial cells within the brain tissue, the liquefaction is a result of their hydrolytic enzyme action, or basically because the brain lacks that firm network or that firm structure that other tissues have, and so it is vulnerable to liquefactive necrosis. Now, liquefactive necrosis occurs mainly in two other areas except for the brain. Now, the first is being pancreatitis. Now, in pancreatitis, what happens is that the pancreas, the enzymes within the pancreas, they get activated within the pancreatic ducts and within the pancreatic parenchyma, and they digest the pancreas and they liquefy that tissue, and it becomes necrotic tissue. And basically any dead tissue, when it collects neutrophils from the bloodstream, and so it forms an abscess. So an abscess and in pancreatitis, basically they both have liquefactive necrosis. Okay, so another type of necroses we're going to talk about is gangrenous necrosis. Now, in gangrenous necrosis, there's really nothing new. It is an ischemic type of injury to the tissue, and it is basically coagulative necrosis to that tissue. Now, however, because it resembles a mummy, and because it's really clinically significant, we chose, the professionals, they chose to name it gangrene or gangrenous necrosis. Now, another thing is that when this is called a dry gangrene, of course, because it is not superimposed by infection. Now, when it is superimposed by infection, what happens is that neutrophils arrive and hydrolytic enzymes, and basically liquefactive necrosis is superimposed with that coagulative necrosis. And so this is called a wet gangrene. So a wet gangrene is basically an infected dry gangrene. Another type of necrosis is caseous necrosis. Now, in caseous necrosis, basically it is basically coagulative necrosis plus liquefactive necrosis. And it occurs in infections, in fungal infections, and of course, the main thing that it occurs in is tuberculosis. Tuberculosis, fungal infections, and granulomatous infections, they all give characteristics to caseous necrosis. And the reason it's called caseous is because it resembles cheese. So it's basically a cheese-like inflammation. And we will talk about granulomas in another video. Now, the other type of necrosis is called fibrinoid necrosis. Now, you remember in histology, the hematoxylin and eosin stains fibrin in a pink color. Okay? So, of course, fibrinoid necrosis basically happens in vessels when upon vessel injury. And the reason of why that is that basically most commonly it is an autoimmune reaction from the vessel, an antigen antibody reaction, such as this patient with polyarteritis nodosa, or basically the patient has vasculitis, or the patient can have malignant hypertension. And now, malignant hypertension differs from benign hypertension is that it is an episodic hypertension, and it results in headache, papilledema, in severe cases, renal failure, and it is basically an emergency. Whereas benign hypertension is basically a long-term damaging hypertension. So this is the characteristic of fibrinoid necrosis. Now the last thing we want to talk about is fat necrosis. Now fat necrosis occurs usually in two cases, basically due to trauma of that fat, such as when a woman is crushed in a car accident or hit on the chest with something. Basically the fat dies, and when the fat dies, it releases the fatty acids. When the adipose tissue dies, it releases fatty acids, and fatty acids basically they have a tendency to bind with calcium, and this is basically called saponification of fat. And this is the reason why we get this chalky white appearance on fat tissue when fat dies, because of calcium deposition in that fat. Now, it happens in pancreatitis as well, when the enzymes in pancreatitis, when the enzymes basically they go out from the acini and they go out from the duct to that peripancreatic fat, and they basically such as lipase enzymes within that pancreatic juice, they digest that fat, they damage it, and they release fatty acids which bind to calcium. So in pancreatitis, we should remember that the parenchyma basically undergoes liquefactive necrosis. However, the peripancreatic fat undergoes fat necrosis. Okay? And this is an important thing. Now, one last remark on fat necrosis is that there's something called, it is an example for something that is called dystrophic calcification. Okay? And basically, dystrophic calcification means that calcium deposits within dead tissue. Now, dystrophic calcification is different from metastatic calcification, because in dystrophic calcification, you have a normal serum calcium and a normal serum phosphate. Whereas in metastatic calcification, it basically, you have an elevated calcium or an elevated phosphate levels. Okay? And so you need to understand each necrosis. You need to understand the causes of that necrosis, and in order to fully get the bigger picture